So welcome back to the Late Aesthetics Show. Today we are joined by the fabulous Dr. Catharine Denning. Thank you for being here.
Oh, it's such a pleasure. Thanks for having me.
And you are, I don't want to blow your own trumpet, but you are one of the UK's top aesthetic doctors, and you're really known for your natural, subtle enhancements. So people come to you and they leave and they're glowing, basically. And you're the founder of Marylebone Skin and Medical Aesthetics, where you're all about scientifically backed, personalised treatments that enhance and not change someone's appearance. So welcome.
Thanks.
So you're originally trained as a medical doctor. What made you swap from stethoscopes to lasers and syringes?
It's a really good question. It's not something I ever thought I would do, truthfully. When I started my career in medicine, I wanted forever to be a plastic surgeon. And that's what I started my training as. And a few years into training, following qualification, I just felt very burnt out and I felt very disillusioned by what I was doing. And I loved the job, but I found it really hard. And there were plenty of things that sort of, poor patients, we weren't able to do a good enough job in my view and give them a really great experience. And so I actually took a year out to teach anatomy. And in doing that, I was working Monday to Friday, 9 to 5, teaching medical students, dental students, surgeons, anatomy, dissection. And when I was doing that, not only did I get a bit of my life back, having, worked very long hours, all weekends and nights, because on the trauma rota, that's what you do. So that was nice to get a bit of my life back. But actually what happened was I met a plastic surgeon she just started doing some aesthetics. Mm-hmm. And we were there on our dissecting table and she said, why are you not thinking about doing this? It's a really buzzy, new up and coming industry. And I, to be honest, didn't really know anything about it. So I did a one-day course initially just to sort of see what the fuss was about. And immediately I saw someone have 0.1 mil of filler put into their cheek. Yeah. And I thought, wow, that made a huge difference. This tiny injection compared to all these major surgeries that I'm involved with, this tiny injection made a huge, huge difference to her confidence. She felt better about herself. She walked out happier. And I thought, wow, there's something in this. So I then went and did my master's in injectables and grew from there, really.
Amazing.
Yeah.
And I bet the industry has changed since you first started in it. Even when I first started 7 years ago in the industry, and I always say this, my background's not being a medical practitioner at all. It's changed a lot. Like what we know, what we understand has completely changed and it's developed. So do you think that it has changed? And do you think we are saying, let's say, goodbye to that typical overfilled look, which gave the industry quite a bad name for a period of time?
To be honest, I still think it does give the industry a bad name. Listen, it's such a booming industry, this. Even in the last 10 years since I started my business, the knowledge that we have, even basic knowledge of the anatomy of aging, has changed enormously. We've also got new technologies. We've got new injectable modalities. There's a huge push now in skin rejuvenation. Some amazing innovations coming onto the market. And that's because it's such a big money industry. Globally, it's worth about 70 billion.
Yep.
And it's projected to make about 300 billion by 2030. So that's huge. It's worth about 3.5 billion in the UK alone.
Exactly.
So I think that the money that drives the industry means that we have just so much access to research, innovation, and also, the demand from the public, the demand from patients is huge. So, where we're going to be in 5 years' time is really hard to say, but I'm excited for it because every year on year, I feel like I'm learning something new, which is fantastic.
I know, we were just saying, in our industry, we have conferences at the start of the year, and I always think that kind of sets the trend for what's going to happen for the next 12 months. I remember IMCAS Paris last year was really big about polynucleotides.
Yes.
You've seen how big they've become
Absolutely.
over the last 12 months.
Yes.
And patients asking about them, for example. And you're kind of known for your age-appropriate results. I think that is really, really important, especially when personalising a treatment plan for a patient. So what's your, let's say, secret to keeping patients looking refreshed but never overdone?
It's a great question. I think the main thing for me is individualization, as you said, respecting natural anatomy and the anatomy of aging, but also understanding what your limitations are. I think a lot of the problems that we see, as we mentioned, for instance, in overfilling of faces, happens because people don't understand where the syringe should stop and the surgery should begin. Mm-hmm. And I think that's a huge thing. And I actually turn away quite a few patients a week because they're not appropriate for injectable non-surgical treatments. Mm-hmm. Really what they need to have if they want to, reduce, let's say, the nasolabial fold or their jowling of the lower face or their neck, they need surgery ultimately, and no amount of injectable treatment will get them where they want to be. So I think it's about being honest with your own ability and also with the patients. And more often than not, even though I'm turning them away, they're delighted because I'm being honest with them.
And you're giving them honest, professional advice.
Absolutely.
And at the end of the day, they're just going to be dissatisfied if you give them, if let's say if you did some filler, for example, then it's not going to address their concern.
No, exactly. And I think for those that are appropriate for injectable or non-surgical treatments, it's about really understanding their natural and their aging anatomy, but also using the right product in the right place, So I always talk about the 4 Ps. It has to be, to get natural looks, it has to be the right patient, the right product, the right practitioner, and in the right place.
Definitely. So true. I love that. I really like that. Do you have like a go-to like protocol that you like to do it with patients, or does it vary from patient to patient?
So every patient that comes into my clinic gets an individual assessment. You get examined and a very long, hour-long consultation with myself and an examination. And then you also see my skin tech who puts you under a skin scanner and we look at all the different layers of the skin. So we really have an approach of skin through all the 4 or 5 layers in the face down to bone and addressing them in an individual manner, because one person might come in who's in their 50s and they have fantastic quality of skin because they've really looked after it. They've worn sunscreen, they've been using their retinoids. And actually then we're not having to address so much of elastosis or sort of pigmentation in the skin. Whereas there may be more of a volume loss issue, whereas someone else coming in might not have such a problem with volume loss, but they might have, pigmentation that might want to be addressed by using a laser or skincare. So it's a really bespoke approach, and that's one of the reasons why we're so well known for our natural results.
I love that. And I think tweakments, I always love the word tweakments because it's about doing subtle enhancements. And tweakments are everywhere, right? But how do they differ from, let's say, aesthetic treatments, and why do you think tweakments are so popular?
So I guess it depends on how you define a tweakment. In my head, a tweakment is a little intervention that you can walk into the clinic, walk out, feel better about yourself, but most people wouldn't necessarily notice the difference. You could come in your lunch break. And I sort of thought that category falls things like anti-wrinkle injections, some smaller injectables like polynucleotides, or maybe a syringe of filler or something. They're just sort of little tweaks that you might have. Let's say every few months you might come into the clinic and just have something done to make yourself feel fresher, rejuvenated. Even in that category, I'd even do things like hydrofacial. So we love hydrofacial in our clinic. It's one of the most popular skin treatments we do. Whereas I wouldn't fall into that category. Things like a full face, a full face treatment of filler, as an example. Yeah. And actually, I do that less and less now anyway. But yeah, you're right. I think the beauty of it is that people come, they leave happy, and no one knows that they've been in. Exactly. So I think it means that to people that are time poor. So my patients are more often than not sort of, CEOs, partners of law firms. They're high functioning people that work in big corporations, businesses, own businesses. And so they can't really afford to leave the clinic looking really bruised. Yeah, exactly. So listen, one of our most popular treatments is our laser. and we use a BBL Heroic Moxie by Cyton, and it's a fantastic tool. But I wouldn't necessarily say that was a lunchtime treatment.
It's not, yeah.
The results are fantastic.
The results are amazing.
Yeah.
Really
they are honestly, like, they blow my mind every single day, and my patients are always delighted with the results, but there is downtime associated with it. So they can't just pop in their lunch break.
Yeah, exactly.
But no, you're so right. It's become extremely popular just to come in and tweak a few things. I think also, as long as people don't get too carried away, it's a quite a nice way of maintaining natural results rather than doing loads in one treatment setting.
Yeah.
You know, having a few tweakments throughout the year just to keep on top of skin health largely actually is quite a nice way of keeping results very natural.
Well, even myself, like when I get my microneedling, when I get my skin pen treatments, I still have to factor in what I'm doing that evening. Like I literally have to just be at home. I can't go out. I can't do anything like online. I have to like literally just sit there and like wait for my redness to go down. That's about it. So I think with let's say the more ablative treatments or the more treatments that demand more downtime, you just have to factor them into your general schedule and what you've got going on.
Absolutely. And I think that's really important for us as practitioners to understand as well, is that the vast majority of our patients can't afford to take a week off work because they look like they're sunburnt.
Yeah, exactly.
But with good counselling and with good planning, the vast majority of patients that we recommend, as an example, our laser treatments to, they'll all take you up on it because they know the results are going to be fantastic, but it's just around planning around their lifestyle.
And the right aftercare as well.
Definitely.
The right aftercare is so crucial.
Yeah, absolutely.
If you could banish one outdated aesthetic trend forever, what would it be?
Oh my
and
God.
Why?
I think everyone has the same answer to this question, do they not? Well, overfilling in general, but overfilled, like poorly performed lip filler, I think, is my big one.
Yeah. And it's obvious. It's very, very
so
obvious looking.
It's almost like, actually, to be honest, I'm going to change that slightly. It doesn't even need to be overfilled. It just has to be lip filler that doesn't respect natural lip anatomy. And actually, I'd say it's one of the most challenging anatomically to get a natural result from. But yet you see so many people walking around looking so abnormal. It's sort of alienization of their face because whoever has been their injector either is following a trend and doesn't care that it looks natural, which is an issue in itself, or they think it looks natural, but actually it doesn't, because it hasn't respected the natural, pedicles, the natural transition between the white lip and the red lip. There's just so many elements of the anatomy of the lip that you have to respect in order for it to look natural. It's quite hard to do.
Absolutely. Do you remember that trend with Russian lips? And it's like, seriously.
I know, but also if you understood the anatomy of the arterial system around the perioral area, you would not be performing that type of injectable technique. It's so dangerous.
Well, I think that the practitioners that are performing that type of trend, they're not really, I would say they're not the most, I don't want to say not the most educated practitioners, but they're definitely not the ones that are like out there leading and shaping the way that our industry goes.
I think I would agree with you, yes, but I think that's absolutely right.
You're not the first doctor who's come on this show and has said that, so don't worry about that. That's fine. You're definitely not the first. I remember my friend Dev Patel, he was on here and he went in on it, like really, really honest. So don't worry.
I love Dev because he never minces his words. He's also a great colleague. I really respect him as a practitioner as well. But one thing you can say about Dev is that he'll say it how it is, which I find enormously respected.
And the funniest thing is, this is like the third podcast. Well, it's not the third podcast that we've done, but it's definitely the third guest that I've had. With somehow Dev's name gets mentioned at some point during it. I don't know why, but he's that guy, isn't he? He's that guy in the industry. And I think one of the great things, so obviously since you first started in the industry, we're developed a lot. As you've said, technology's developed, in advancements in like skincare, in injectables, that's all developed. And I think now we're seeing a big like shift into biostimulators. So what are biostimulators? I think maybe people have heard of brands such as like Profilo. They've maybe heard of polynucleotides. I think the Kardashians mentioned polynucleotides. So what exactly are biostimulators?
So that's another great question. So in my mind, biostimulators are injectable treatments that get your own body to stimulate fibroblasts to make collagen, elastin, hyaluronic acid. there is quite a wide range within that category of injectables, I would say. So you obviously have your hyaluronic acid based biostimulators, and you've mentioned Profilo. There's a few other hyaluronic acid based skin boosters that are fantastic. And they largely are hydrating the skin, and there is supposedly some biostimulatory effect from those hyaluronic acid based injectables as well. You then move into more like the sort of, as you've already mentioned, polynucleotide, which essentially relies on broken bits of highly purified DNA, usually that's extracted from either trout or salmon gonads, hence why it's had this ridiculous adoption of salmon sperm facial, which
it's not even a facial.
I know it's not a facial, and it's not actually sperm either, so it's sort of not really, yes, but I guess it's marketable, isn't it? So that's why that's happened, like with lots of things in the industry. So the idea behind that is that you're injecting broken bits of DNA, i.e. polynucleotides, and by doing that, you're almost tricking the body into thinking that there's an injury in the skin. We know that if you cut yourself, DNA gets broken and your body recognizes that as being a wound. So essentially what you're doing is you're skipping the wound step and then just injecting broken DNA into the skin. And therefore your body's reaction to that is it upregulates lots of cellular pathways and signals to upregulate your wounds healing pathways, which are getting your fibroblasts essentially to produce more collagen and elastin. You then move down into the slightly more extreme injectable biostimulators, things like poly-L-lactic acid, so Sculptra as an example, which we do quite a lot of in clinic, that there are other biostimulatory calcium hydroxyapatite combinations as well, and other elements of lactic acid derivatives as well. So that's, I would say, one of the more extreme ends of the spectrum in terms of results, which makes it somewhat a little bit riskier perhaps in terms of when you're counselling your patients, but the results on the whole are more marked. So, and they tend to last a little bit longer. So as an example, I do a lot of polynucleotides in my clinic. We tend to use Planest, which is derived from trout gonads, and we tend to do that a lot of in the under eye, but also in the skin itself. But it's a certain type of patient. I wouldn't necessarily be using that as my main biostimulator in some of my slightly older patients in their sort of late 50s, 60s, where they have a lot of elastosis. Really, these patients need something a little bit more bioactive. So something like Sculptra. Exactly that.
Well, I mean, I really rate polynucleotides. I had a course of them under the eye area, and I really rate them. I mean, not necessarily the immediate improvements, but you really notice the improvements as the weeks and the months go on. Especially obviously if you're doing the right at-home skincare routine. So I really rate them, and I think for anyone, let's say in their like late 20s, early 30s, I think that they fit that mark.
Absolutely.
Really nice.
I'm actually really finding that it's replacing a lot of need to do tear trough filler now. So whereas before, tear trough filler was one of the few things that we could do to help with volume loss and dark circles under the eyes, now I'm finding that I'm replacing quite a lot of, particularly as you say, in the sort of slightly younger patients in their late 20s, into really sort of the late 30s in a lot of cases now. I'm now, because it's making the skin so much more robust, there's some data to suggest that also it's affecting the muscle layers. So if you're getting myocytes proliferating in the muscle layer as well, you're obviously going to be helping that skin tightening from the deeper layers. And one of the reasons we know that the eye ages is that periocular muscle gets weakened and gets sort of almost gaps and descends further down the face, and so you then get bulging of fat between it. So if you can preempt that change by using something like polynucleotides to help keep that muscle strong and build that muscle, then we should be using it in the vast majority of our patients, So it'd be interesting to see where the data goes with that. It's early stages with the science behind polynucleotides. It's been a product that's been around for a long time, over 20 years, but the actual clinical data, it's less than we'd like. But as we've already seen, the results are fantastic.
Yeah.
I'm using it every single day in my clinic, and now the science is following, which is really exciting.
Yeah, no, that's great. What about things like PRP? Are you a big advocate of PRP? Do you use it in the clinic? It's kind of one of the first things that people have heard of. It's been around for a while. The whole vampire facial side of things, it's been around for a
Another
while.
Great Kardashian marketing term.
Just get the Kardashians to have any treatment you want people to know about,
Yes,
and
exactly.
they will push that for you. But yeah, what's your views on PRP treatments?
So I actually really like the results that PRP gives. I used to do a lot of PRP really before we had access to things like polynucleotides, before we had growth factors on the market quite so much. And then we've also moving into this new realm of exosomes.
Yes.
So I used to do a lot of it. I'm actually finding now it's quite cumbersome as a treatment, and there's a fair bit of downtime associated with it. And so patients now, I'm seeing just as good results with things like needling and exosomes.
Yes.
Or polynucleotide treatments. And so actually I'm tending to err away from doing PRP, not because I don't think it's a fantastic treatment, it is, and it's particularly good actually for hair growth. Actually, I find it's really, really good for scalp treatments for people that have thinning hair or losing their hair. Okay. But I'm finding I'm not needing to do it as much because these other treatments that are coming through tend to have better downtime. They're less painful. They're less cumbersome. PRP takes a little while. By the time you've taken blood, you've put it in a centrifuge, you've then extracted that, and then you go to do the procedure.
You think the newer treatments are replacing the need necessarily for PRP in certain situations?
Listen, I think PRP will always have a place. The science behind PRP is really good.
Yes.
Whereas some of the newer stuff coming through, whilst we're getting fantastic results, maybe the science isn't quite caught up yet. Yeah. But no, I mean, I like PRP, but I'd say really on balance, the newer treatments are giving just as good results. So
that's specifically PRP for like general skin rejuvenation, but I'm pretty sure, correct me if I'm wrong, you can use PRP for joint pain, any like knee pain or anything like that, and it can help to regenerate tissue.
Yes, exactly. So actually, yes, you find what's really funny actually. So we're going to slightly take a detour off human medicine here, and actually, it's really big in veterinary medicine.
Ah, okay.
And one of the things for instance, in the equestrian world, particularly in eventing and in racing, they use a lot of PRP in injury.
Okay.
They're also starting to use a lot of fat stem cell transfers and things like that, with really, really great effect. And depending on obviously the veterinarian that you talk to, some absolutely rave about it, some don't think the science is there yet. So it's sort of this funny sort of mirror image of what we're doing in aesthetics. I'd say that things like from a medical point of view, doing things like PRP into joints, and we know that sort of next phase of that is to try and introduce stem cells. So there's quite a lot of orthopedic surgeons, particularly in the US and in Europe, that are using stem cells for joint pain, for arthritis, for injuries that are doing pretty well. None of it's FDA approved yet, or the vast majority of it isn't. So it's often off label. But the fact that they're getting such good results is exciting.
Yes.
And I wonder whether could you then extrapolate that for things like exosomes, for things like polynucleotides? I mean, who knows? Yeah. But it's just interesting the direction in which it's heading.
Exactly. That leads us into this term, which has become like a popular term this year, from around the start of the year, end of December, when people are predicting what the trends are going to be for the next year. Collagen banking. So collagen banking is a term where, let's say in our 20s or 30s, we can do things to stimulate our body's production of collagen, and then the body, in theory, will have more collagen. So we don't need to do things at 40s, 50s, because there'll be collagen there. What are your views on collagen banking as a whole?
So collagen banking, although it's quite trendy to talk about at the moment, it's been around for a long time.
Yes.
As we know, things like microneedling, it used to be called collagen induction therapy sort of 10 15 years ago. You don't sort of tend to see that so much anymore. So we know that collagen banking is a thing, right? And we know that from the age of about 20, our collagen declines for about 1% a year. And then if you're a biological female, when you hit that perimenopausal or menopausal years and your hormones shift in quite a big way, that collagen suddenly drops even further. And so things like if you can try and for me, this is all about skin health, right? It's less about aging per se, although obviously that's what people want out of it. It's more for me about trying to get the skin to behave in as youthful way as possible to maintain its health for as long as possible. A bit like general health, isn't it? If you can be as preventative as possible, eat healthily, exercise regularly, you know, it's the same with the skin. If you can protect your skin, and that does include obviously things like sunscreen, using retinoids, but if you can collagen bank from your early 20s, then I would say that it's a good idea to try and do that. Listen, collagen banking isn't the panacea of anti-aging, because we know that it's not just the skin that ages. Every layer of our face ages. So, you know, collagen banking isn't going to stop the aging process. But what it does do, as I said, is keeps that skin behaving in as youthful way as possible for longer. And then you hit your sort of perimenopausal, menopausal years, you know, you're then starting from a much better position than if you hadn't done.
So at what age do you think that that somebody should start considering having I don't know, let's say some general skin treatments? From what age is a good age to begin that?
Hey, listen, I think skin health starts from childhood.
Yeah.
You know, I'm very lucky. My mum is Antipodean. She's from New Zealand. And so we were taught to wear sunscreen every day from day dot.
Yeah.
So I've been slathered in sunscreen my entire life.
I know.
But what a gift my mum's given me. I've never even thought twice about it. It's just been part of my daily life.
Yeah.
So in terms of skin health, I think, you know, there's no such thing as too young to start. I don't think that translates necessarily into using anti-aging skincare and anti-aging aesthetic procedures, and I think we have to be really careful about what audiences we're targeting with those marketing messages, because we know now that, you know, teenagers, young teenagers, as sort of as young as 13, are using supposed anti-aging skincare.
Yeah.
That's terrifying, not just from a skin health perspective, because, you know, you do not need to be, and you shouldn't be using strong retinoids and acids in your early teens. Your skin just is not designed to be using skincare like that. But also, I think from an ethical point of view, it's not bad to age. I think in this industry, we've got to be really careful about that, the message that we're giving people. To age is a privilege. I look around the world at the moment and there's so much going on. There's plenty of children that are not going to make it into adulthood. And you think, we are so lucky to get older. Like, we really are. It's a privilege.
Yeah.
It doesn't mean to say that we can't look after ourselves, look after our skin, feel the best versions of ourselves as we get older. So I think it has to be age appropriate, the interventions that we're talking about.
I completely agree. And I've seen there's companies out there that are promoting skincare for babies. Have you come across that before?
Even some of the designers companies,
they're promoting skincare for babies. But even I've seen doctors that promote skincare for babies, and I'm like, they're babies. Like, they're literally babies.
Yeah.
I don't think it's necessary for babies to have skincare routines.
Absolutely not. Like, listen, okay, they probably, but we know that baby skin dehydrates quicker than adult skin, so you want to probably introduce a moisturiser, but it has to be baby appropriate.
It has to be a baby appropriate one. You can't then start a skincare line for babies.
Absolutely. But again, it's not even just the health of the baby and the skin health, it's the messaging that we're putting on our children. It's just so unethical, I think.
And if you even think about the youth now, like if you look at 15, 16-year-olds, they are so heavily influenced by social media.
Yes.
And that's at 15 and 16.
Yeah,
I
so
was
young.
Influenced when I was 15, 16. It was all starting at that point.
Yeah.
But if you start putting this on babies, then toddlers, like where does this end?
I know, it's terrifying, isn't it?
It's nuts.
Yeah.
So 100% agree with you. Age appropriate treatment plans.
Yes.
That's basically what we need.
Yeah.
And I think as well, I always think you go see a professional about your skincare routine. Don't just go to, a high street shop and just pick a few things, because you don't know what is really in that. You probably don't understand the ingredients list on the back. So at least go and see a professional that will give you, professional advice.
I mean, I think so. Listen, it's easier said than done. Not everyone has a budget to see a professional, right? So that's the tricky part of it. Ideally, everyone would have access to a dermatologist, an aesthetic doctor, whatever it looks like, a skincare professional. And sadly on the NHS, that's not possible at the moment. The wait lists are,
far too long,
over a year, even for significant skin issues. But that being said, I think if you can justify and afford to see a skincare professional, I completely agree with you, because the fact is that everything needs to be tailored to your individual needs. So just because you've read something on TikTok or Instagram that someone else is doing with their skin does not mean to say that it's appropriate for your skin. And actually one of the things that I'm really noticing, and I have done really in the last 5 years, particularly as social media has just blown up in the skincare industry, is that people are destroying the barrier function of their skin, and they're coming in with perioral dermatitis. I've seen 2 already today, and I've got several consultations booked in because people are suffering from perioral dermatitis.
Which is so difficult to
it's really hard to treat. But the vast majority of these people, okay, there's different causes of perioral dermatitis, obviously, but the vast majority of these people is because they've just stripped the barrier function of their skin. They've been overusing exfoliating acids, they've been overusing retinoids, and not replacing that skin's barrier function with, decent ceramides and looking after the sensitivity of their skin. So yeah, it's an issue, definitely.
So what do you do in that situation? What treatment options are there?
Hey, listen, it obviously completely depends on the patient and what's what the likely cause of it is. My general advice for people like that, though, is just to completely strip back your skincare and use very basic, over-the-counter ceramide heavy skincare. So brands such as Curel, Cetaphil, CeraVe, they're all a really good price point. You can get it from Boots, and they do really good ranges of ceramide heavy skincare. And then really it's about trying to work out what's caused that, because in some people it might be fluoride in their toothpaste. In other people, there's even a correlation between having gel nails and having perioral dermatitis. So generally speaking, I say to people, listen, just trial in the short term. Listen, fluoride's important in toothpaste for oral hygiene, but in the short term, you can go off using fluoride scented toothpaste. Yes. Exactly.
Yeah.
And actually stop using any steroid creams that you might be using for inflammation, because that also contributes towards it. And actually the other thing I'm telling people to do now is stop getting gel nails until it's subsided, because you don't know, that might be the cause.
And it's kind of like eliminating what the possible cause could be, and then forming a plan based on that.
Exactly. Yeah. But I mean, I think from a skincare point of view, strip it back to very basic and use ceramides to replace the skin barrier.
I know so many people that have suffered with that, but I do agree, because it's when they start adding random products into their routine.
Yeah.
This new product's come out, I really want to try that, and then they add these products in,
and
then all of a sudden they have flare-ups that they never had previously.
Yeah, absolutely. Yeah. One ingredient that I'm finding often is very helpful is to use azelaic acid in as part of the treatment protocol, not necessarily from day one, but I'm finding that can be also really helpful, because it's very anti-inflammatory, it's a good antioxidant. But yeah, but a prescribed percentage, so 15 or 20%.
Okay, great. So if somebody came to you and said, I would love to have the ultimate glow up, what's your go-to? What's your treatment protocol?
Oh my goodness.
And what's your dream team of aesthetic procedures that you would like to have?
Okay. Do you know what? I approach everything in layers. So for me, if someone wants an ultimate glow up and there's no budgetary constraints and they're not worried about downtime, I would start from basic skincare all the way up to all the injectables and laser. So I would approach the skin first, really good skincare, obviously individualized by using our skin scanner, and then moving into things like using laser if there's any discoloration for rejuvenation. And then it's about treating all the layers of the face. So if they've got any volume loss, it might be appropriate to use either a biostimulator or a hyaluronic acid filler. If fine lines and wrinkles are an issue, or if hyperdynamic muscles, particularly in the lower face, are an issue, then maybe using some neuromodulators. I mean, honestly, I would just approach every single layer and just go for it.
Everything. But it's good, because you'll have like a whole army of different tools in your clinic that you can use, and they're all, the purpose of them is for different different concerns,
absolutely.
Different budgets, different time frames.
I think the key to having the ultimate glow up, though, is long-term relationship. And I think what I say to people is, listen, it's irrelevant. If you don't come to me to get injectables. You come to me to have good skin health, okay? And sometimes that means having, every 6 weeks having a facial or microneedling or a peel or whatever it might be. And then once that skin health is sorted, then maybe we talk about things like a bit of volume restoration or, maybe a course of polynucleotides or whatever. But it's about that journey. And I think the long-term relationship's really important to get people to where they need to be. It's not like a one quick fix solution.
It's what we do day in, day out that really makes the ultimate difference.
Yeah.
And that you do that with the food that you eat, you do it with how active you are on a daily basis. So there's no different when it comes to your skin.
Completely.
And it's the largest organ as well. I think people do tend to forget that the skin is the largest organ we have.
It absolutely is, yeah.
So it's as important as all the other vital organs that we have. I mean, it protects us from the outside world.
Absolutely, yeah, absolutely.
So you obviously are known as the skin whisperer. I don't know who gave you that name.
I have no idea. I'm going to take it though. It sounds very ethereal.
You trademark it to me. I'll be like, I'll give you the skin whisperer title.
Of course, my love. Yeah.
And you see obviously thousands and thousands of patients each year. What are the 3 biggest skin issues that you see on a regular basis? So
again, going back to that sort of the TikTok era of skincare, I more and more am seeing barrier dysfunction. So whether that's perioral dermatitis, whether that's just hypersensitivities, but also things like the inflammatory skin conditions such as rosacea seem to be, to me, on the rise of the people coming through my door. So that's the inflammatory kind of skin. Listen, I'm not a medical dermatologist. I don't treat things like eczema. I don't treat things like psoriasis. We do treat people with rosacea, but that's that sort of inflammatory sort of barrier dysfunction type of skin I'm seeing quite a lot of. We always, and probably more and more now, are seeing solar damage to the skin, and we know it's causing about 80% of our external aging process to the skin. So UV damage is a thing. We know that. A big thing. But yet, especially with patients that are sort of in their sort of slightly older years that didn't really look after their skin when they were younger because it wasn't really known at that point to wear sunscreen every day. So we see a lot of dyschromias, and by that I mean sort of sun damage and pigmentation issues in the skin. Things like melasma, which aren't just UV driven, they're more complex than that. But pigmentation as a whole is something that we treat almost every single day in the clinic. And then just general skin aging. So having lost that bony platform, fat pad platform, and the structural elements of the skin, but also the elastosis that's associated with UV damage. We see a lot of that, particularly in people in their sort of late 50s, early 60s, again, that haven't really necessarily known to look after their skin from protecting it from the sun. So I'd say probably those 3 categories are the things we see most of in clinic.
Okay, great. If someone is looking tired and dull and just feeling a little bit sort of like low, you get that like dull non-glow actually. What's your go-to fix?
Do you know what? I love a hydrofacial.
So do I.
It's fantastic. It's so relaxing and quick, but it's so effective. You walk out of the room like a completely different human, don't you?
Your skin is glowing after a hydrofacial.
Yeah, and I think no matter how, listen, I feel like I look tired today. My toddler was up all night last night because he's got his molars are coming through. Yes. So I'm knackered. The one thing I want to do today is, if I've got time, is get my skin tech to do a hydrofacial on me, because I know that I will feel infinitely better. I think if you can do a combination of hydrofacial and polynucleotides under the eyes, obviously not in the same session, that would be probably my absolute go-to.
Yeah, that's a good one.
Yeah.
And what's your secret weapon treatment that you think more people need to know about?
Do you know what I think makes a huge difference? And again, no one comes in realizing it is the skin pigmentation issue. Unless people have very significant pigmentary issues that they really notice day to day, then it's a bit more obvious. But what I find is people come in wanting a bit of filler or anti-wrinkle injections, neuromodulators, but actually what they'd benefit most from would be to address the dyschromias in the skin. So the sunspots, and they don't even, most people don't even realize they've got them.
That's so true. Yeah.
And actually what I find is it's, you know, I'm there sort of going, I know you really want the quick fix of having a neuromodulator, but actually what I think is you'd benefit really well from a course of BBL Moxie laser.
Yeah, I've seen the results from that and they look absolutely fantastic.
Honestly, and actually it doesn't then matter if you've got a wrinkle because your skin health looks so much better.
Yeah, totally. And it's like having that clear complexion.
Yeah, definitely.
Which is great.
And I think it's so underrated, particularly in aesthetics, because I think we focus a lot on injectables and no injectable really treats that element of skin health.
Yeah, and I think quite often if you've got a concern, let's say with the upper part of your face, just by improving the upper part of your face isn't going to make a difference when you really look in the mirror, because then you'll probably start focusing on the mid part of the face, the lower part of the face. So if you could just improve it all in one go, you're gonna glow basically.
Yeah, absolutely. Yeah.
Okay, great. So we'll do a quick fire round. So just give me like the first thing that comes to mind when I ask these questions.
Gosh, okay.
Morning or evening skincare routine, what's more important?
I think you've got to say morning just because of the sunscreen, right?
Yeah, that's true.
You know?
I mean, I put more effort into my morning routine, I think, sometimes than I do my evening routine.
Yeah, and also, yes, I think generally speaking, most of the skincare routine does sit in the morning, doesn't it? You know, generally speaking, if you're going to use a hyaluronic acid, if you're going to use peptides, often you'll use them in the morning. Mm-hmm. I think for me, it has to be morning just because of sunscreen.
Yes, exactly.
The only reason I'd ever choose PM is for retinoids, exactly. But actually we've now got really well encapsulated retinoids that you can use in the day.
Yeah.
So actually I would probably say as long as you're
taking your
daytime as long as you're taking your makeup off, exactly. That's true, the makeup element. But no, as long as you're wearing a good sunscreen and you're using the encapsulated retinoid you can use in the morning, I'm kind of like, I'm cheating a bit here, aren't I?
Just,
I'd say morning.
I do. I put more effort into my morning routine. I think when it comes to the nighttime, I'm tired.
I know.
Like,
you cut corners, don't you? I know.
And, you know, I literally just cleanse, like put my retinoid on, and then I'll put like a moisturizer on. I'm really, really lazy in the evening, but it's effective. This is the whole thing. It's an effective routine. So what's one skincare product that you cannot live without?
I mean, it's really boring to say sunscreen, but that is my answer. But I'd say actually, I'm going to say I've started using the Elastin range, and I love their HA Intense. I don't know if you've ever tried it.
I've started using their like moisturizer.
Yeah, honestly, their HA Intense is incredible, and I use that alongside their skin complex, and the glow is next level.
Oh, nice.
Like honestly, next level. I started using actually that range not for day-to-day skincare, but for my post-laser patients. So their whole remit is that they do peri-procedural skincare.
Okay.
And their most popularly used one, I think, is called Skin Nectar. And you use that. I prescribe that for my patients post-laser.
Yeah.
And it's fantastic, and it reduces downtime. And the point of it is it's peptide heavy. So that it works at a genetic level. We know that it affects genes transcription. It's really interesting. It's such interesting science. Anyway, I've now started using it, and from a day-to-day skincare point of view, and I'm blown away. Actually, I have to say,
go definitely.
Yeah. Well, I'll pop and get some for you, and you can give it a go because it's fab.
Thank you. What's the most underrated aesthetic treatment?
I actually think something like microneedling.
Yes.
I love it.
It's quick. It's great.
It's so quick, and you get a fab result. My mum, who, you know, she won't mind me saying this, she loves an aesthetic procedure. I think it helps that she is my mum. So she's open to all things. And she still maintains that microneedling plus either growth factor or exosomes is her favourite treatment. Amazing. And she's had everything. And I'd say probably similar. Most of my patients, they won't skip the microneedling session.
I love the microneedling. No. I really, really rate it.
Yeah, me too.
What's your favourite treatment to perform as a doctor?
Oh my goodness, this is a really hard question. Oh, I think delayed gratification wise, it's sculpture because the results are incredible. And it sort of does things that most other non-surgical interventions does.
Yeah.
Or I love zapping pigmentation and capillaries with the laser.
Yeah. It's satisfying. It must be really satisfying.
So satisfying. Like 1 minute there's a capillary there, the next minute it's gone.
Yeah.
That's really satisfying. Maybe I'd have to say my BBL Moxie laser.
Yeah.
Particularly the BBL Heroic. Yeah,
the results are fantastic.
Yeah.
What's the best skincare advice you could give in 5 words or less?
Oh, never skip your sunscreen, obviously. I think probably everybody says that, don't they?
Yeah, but never underestimate the importance of sunscreen, SPF. Yeah. It's like, so important.
As Baz Luhrmann says, you know.
Exactly. Even if it's cloudy, wear your sunscreen. I think people think, it's not cloudy, I'm going to be inside, it's fine. It's not really, is it? So, Dr. Denning, it has been such an incredible chat with you. Really, really insightful. Where can people contact you if they want to find out more about the services you offer, book a consultation? How can they get in touch with you?
So probably the first port of call is our website, which is maryleboneskin.co.uk. From there, you can see what services we provide, but also there's a contact form. There's also telephone number, email address. My secretary and patient liaison, Charlie, is so hot on the emails that nothing ever gets missed. So if you wanted to email us, that's info@drdenning.co.uk. But we also have social media presence. I have my personal Instagram, and we also have our clinic Instagram.
Yes.
So yeah,
Which will be tagged on this. So anyone
have a look in the show notes.
Just reach out. Yeah, exactly. Anyone can reach out. It's fine. And I think, look, any listeners who are looking for like natural led, result driven, and will walk out glowing but looking the best that they possibly can, I think you need to really check out Dr. Catharine. And as always, thank you for being a guest. And everyone who's listening, please make sure you subscribe and you comment as well. You've been a great guest.
Thank you. Thank you so much for having me. It's been great.
Thank you. Thanks.